How does immunotherapy work for lung cancer treatment? Imagine your immune system as a highly trained team of soldiers ready to defend your body. Sometimes, cancer cells are clever enough to hide from these soldiers, making it hard for your immune system to recognize and attack them. Immunotherapy helps turn the tide by boosting your immune response against lung cancer. Most immunotherapy treatments for lung cancer focus on blocking certain pathways that cancer cells use to escape immune detection. These pathways are like brakes that slow down immune cells called T cells. Normally, these brakes prevent the immune system from overreacting and causing damage. But lung cancer cells often exploit these brakes by producing proteins like PD-L1, which bind to PD-1 receptors on T cells, effectively telling the immune system to stand down. Immunotherapy drugs known as immune checkpoint inhibitors block these interactions. By doing so, they releases the brakes, allowing T cells to recognize and attack cancer cells more effectively. The most common drugs used are monoclonal antibodies that target PD-1 or PD-L1 proteins. Examples include pembrolizumab, atezolizumab, and nivolumab. When these drugs block the checkpoint pathways, they reactivate T cells, which can then seek out and destroy cancer cells. This process can lead to shrinking tumors or slowing their growth, especially in patients whose tumors express high levels of PD-L1. Immunotherapy can be used alone or combined with other treatments like chemotherapy or radiation, depending on the specific type and stage of lung cancer. For some patients, immunotherapy has become a first treatment option, replacing traditional chemotherapy, because it often has fewer side effects and can improve survival rates. The success of immunotherapy varies from person to person. Factors like the level of PD-L1 expression on tumor cells and specific genetic mutations influence how well a patient responds. That's why personalized treatment planning is so important. Doctors carefully evaluate each patient's tumor characteristics to decide if immunotherapy is suitable and to tailor the best approach. Beyond checkpoint inhibitors, researchers are exploring other immunotherapy methods, such as cancer vaccines and adoptive cell therapies, which aim to further enhance the immune system's ability to fight lung cancer. In summary, immunotherapy works by blocking the mechanisms lung cancer cells use to hide from the immune system. By releasing these immune brakes, it enables T cells to detect and attack cancer more effectively. This approach has revolutionized lung cancer treatment, offering new hope for many patients. However, because each person's cancer is unique, treatment plans should always be discussed with healthcare professionals to ensure the most appropriate and personalized approach. Remember, ongoing research continues to improve these therapies, making them safer and more effective for future patients.